Okay, good afternoon, everybody. My name is Joshua Vasquez, and today I will be doing a presentation on hyperbilirubinemia. And this presentation will be regarding or surrounding the central question of in newborns with hyperbilirubinemia, do early interventions of phototherapy and heliotherapy compared to delayed treatment reduce the probability of hyperbilirubinemia symptoms within the first month of life? So before we go into phototherapy and heliotherapy and their ability to treat this condition, I want to first elucidate on what it is and why it's important to do this type of presentation on it. So basically, hyperbilirubinemia is it's basically jaundice. So it's basically describing elevated TSB levels, which is the total serum bilirubin levels in the bloodstream. And what you're going to see with the patient with hyperbilirubinemia is you're going to see jaundice, which is yellowing of the eyes, yellowing of the skin, excess bilirubin in the blood. Pretty standard symptom to have with this kind of condition. Now, sometimes it's rare, but sometimes that bilirubin moves into the bloodstream, from the bloodstream into the brain tissue, causing kernicterus, which is a condition that can cause things like CNS damage, brain damage. The baby might experience difficulty feeding, low muscle tone, tense muscles, things like that. So it's a very serious condition and it's a very problematic condition, and that's why this is important. Um, Hyperbilirubinemia affects hundreds of thousands of newborn infants worldwide, 60% of full-term and 80% of preterm neonates. So it's a very prevalent condition. And basically, the main claim of this slide presentation is that early screening and treatment is paramount for hyperbilirubinemia to prevent things like kernicterus and other things like in this next slide. This is going to be discussing the repercussions of hyperbilirubinemia. So there's a lot of different studies from Ross, Turkel, Hakkinen, different types of studies that have delved into how hyperbilirubinemia affects infants and neonates specifically. It's also important to keep in mind with these studies, hyperbilirubinemia is an aspect of what they're seeing symptom-wise, but it's not the main cause, right? So like an infant would have hyperbilirubinemia, but they also have other factors that are involved, like low birth weight. They're going to have maybe difficulty feeding, blood type incompatibilities with the mother. There's a lot of different factors that are also involved in this. But from the studies that I gathered from the systematic review, there are some cases where patients that have elevated TSB levels might have limitations of chorioarthrocoid cerebral palsy. They might have inhibited motor controls. They might even have hematological abnormalities because of the decrease of survival and production of blood cells. There's a lot of different things that hyperbilirubinemia can be a risk factor for. It may not be the main cause, but it is involved in it. Another thing is sensory development in full-term infants. It's going to be maybe lower and be affected by this. So just something to keep in mind. Kernicterus is the ultimate problem that can be caused by hyperbilirubinemia, but these are also other clinically observed issues that have been caused by hyperbilirubinemia as well. So, what is the solution? Basically, the solution is phototherapy or heliotherapy, which is a very exciting concept that people are doing research on nowadays or recently in the past couple of years. So, phototherapy or IEPT, which is intense electric phototherapy, is the primary form of treatment in regard to treating this condition. And this is one type of phototherapy. It's kind of like a light box, and the phototherapy light comes on, the baby's inside. It'll basically eliminate the excess bilirubin levels in the bloodstream. And so that's the main way to solve it. But there has been some studies regarding heliotherapy as being a cheaper form of treatment that can have tremendous usage in underdeveloped regions because of it's way cheaper because a phototherapy light box may cost, a lot of money, but heliotherapy is free because it comes from the sun. So I included this image from The Lion King. Um, Very true, actually. The heliotherapy in the next slide, I discuss a clinical study where they gathered 1,854 neonates that were screened for severe hyperbilirubinemia. They separated them into two groups, and so basically that's what it's showing here. So 97% received the heliotherapy, 95 received the IEPT. They basically gathered all this information at the end. They analyzed the 77 at the end for heliotherapy, 95 at the end for IEPT, because maybe some of the patients sadly, unfortunately passed away. Maybe some of the patients did not receive full treatment. So all of these limiting factors of the study were taken out. So they removed those patients from the group. They only accepted the patients that had received the full treatment and did not pass away. So from those numbers, researchers discovered that the FSPT group, or the heliotherapy group, reported an estimated 93.9 success rate, which is only 3% less than the IEPT reports, which is the phototherapy of 96.9%. And that's very significant because it shows an alternative. There are a lot of underdeveloped regions and a lot of underdeveloped hospitals that do not have the adequate resources to provide care for patients with hyperbilirubinemia, or maybe they don't have enough of those resources to properly treat a variety of patients that are suffering from this condition because, as aforementioned, 60% of full term, 80% of preterm, that's a lot of babies to treat with this condition. So heliotherapy provides an alternative and can be immensely significant in clinical practice. So, dangers of the phototherapy. There are studies that show that phototherapy can have hematological abnormalities, and this can be because the phototherapy is so strong in destroying the bilirubin, it sometimes can attack the cell membranes and can lead to increased cell vulnerability due to apoptosis. So it's going to lead to some hematological abnormalities potentially. One of the studies showed that newborns who received treatment for more than 48 hours were approximately twice as likely to have anemia and thrombocytopenia, which are hematological abnormalities. So phototherapy, if not used correctly or not used efficiently or used inappropriately or used excessively, can have potentially counterproductive effects, similar to these two guys rowing. One's rowing one direction, one the other, counterproductive. So, is phototherapy effective? Now, this is one of the studies that I included in my annotated bibliography, and it was basically showing, it was basically showing that the phototherapy is effective. The mean total serum bilirubin measurement at presentation, so prior to the phototherapy, was around 12.12 plus or minus 4.6 milligrams per deciliter, with the levels after phototherapy being 8.4. So a significant drop, and you can see that present before and after. And phototherapy is an effective and viable method for treating hyperbilirubinemia, and it is the most um, prevalent. Actually, it's the best way to treat it initially. So, yes. Uh, Essentially, phototherapy and heliotherapy are both effective strategies to help reduce TSB levels in newborns. Early screening and treatment for hyperbilirubinemia is essential. That is the premise of this entire slideshow, is that early screening and treatment is crucial. It's not just treating it, it's recognizing it as soon as it occurs. It's early TSB level readings, it's early phototherapy treatment or heliotherapy treatment, depending on financial situation in the hospitals or however you want to treat the patient. It needs to be done very early, which is the proposal for this presentation, is that it needs to be done early. It's also important to keep in mind that phototherapy can be dangerous if it's used excessively or inappropriately. So it's very important to keep in mind constant tracking of bilirubin levels, keep track of red blood cells, keep track of potentially dehydration, burns, etc. We have to keep monitoring the babies as they're in the incubators or as they're in these devices. With heliotherapy specifically, it's very important to keep in mind that when you have the baby outside in direct sunlight or through the filtering, you have to monitor for dehydration. You have to monitor for symptoms like that, maybe hyperthermia. You have to monitor for these conditions. So All in all, it's important to remember that phototherapy and heliotherapy essential for treating hyperbilirubinemia. Early screening, early monitoring is paramount, and expeditious treatment is far superior to delayed treatment, which answers my PCOT question. And that would conclude my presentation. Thank you guys for watching, and here are my references. And thank you very much, everyone, for watching this presentation. I hope you have an amazing afternoon. Goodbye.